It's now the law of the land in California. In the new year, the Golden State became the first in the nation to offer comprehensive health care and specifically health insurance to all qualifying undocumented immigrants living here.
This is smart. It's a good investment for us in California, and it's a humane thing to do.
Senator Maria Elena Durazo authored the law. It offers full-scope Medi-Cal insurance to an estimated 750,000 undocumented Californians aged 26 to 49. Before this year, the state already offered the coverage to all other age groups, including undocumented children, young adults, and those over 50.
Our goal is to reach all Californians, make all Californians have access to see a doctor.
Durazo stresses Medi-Cal is geared to those with low income who otherwise may not be able to afford health care. Under the plan, they will have access to primary and preventive care, pharmaceuticals, and specialists.
We just can't afford it.
Republican Assemblymember Bill Essayli argues the new policy could cost the state billions of dollars. Differing estimates show the exact cost is not yet known, but could be anywhere between $2 and $6.5 billion annually, something Essayli argues is not sustainable given California's budget deficit the governor projects is $37.9 billion, and the nonpartisan Legislative Analyst's Office projects is even higher at $68 billion. That, Essayli says, was the main reason why he introduced legislation to stop funding for the new health insurance law.
We have a deficit. We're going to have to make cuts. I think the prudent thing to do would be to cut aid that's going to go to basically our foreign nationals. We have to take care of our own, of Californians, before we take care of citizens of other nations.
But Durazo says the policy will actually save the state money over time, arguing it will reduce the number of uninsured patients in emergency rooms whose visits are often paid for by the taxpayer.
Right now, those who are uninsured end up at an emergency center, and that costs much, much more.
Still, Senate Republicans believe now is not the right time for the policy. They've asked the governor to put it on hold for now amid the deficit and amid the migrant crisis at the U.S.-Mexico border.
It's not fair for California taxpayers to pick up the cost of what the federal government is dropping the ball on.
But earlier this month, Newsom said he's determined to keep the policy in place.
I believe in universal health care. I believe it's a fundamental right. It's well within our capacity to make that investment, and we made that commitment years ago, and we're going to fulfill that commitment.
And those who qualify can apply for health insurance on the Covered California website. Reporting at the state capitol, covering local news that matters, Eitan Wallace, Fox 40 News.